which he has become a key advocate for all rare diseases in order to get equity in healthcare. Mr. Riafe holds several certifications, and I'm just going to mention some of them. He holds an advanced training in human genetics and genomics from the USA, and also genetic counseling from Wellcome Connecting Science in the UK. He is an alumnus of the University of Ghana and is currently pursuing a PhD in public health at the Fred Newton Benker School of Public Health. That is the University of Health and Allied Sciences right here in Ghana. So Mr. Riafe serves in several global health leadership roles. He is a former co-chair of the LMIC working group, that is the Undiagnosed Disease International. He also is a former vice chair, of the Patient Advocacy Constituent Committee under the International Rare Disease Research Consortium. He is also the co-chair of Africa Rare Disease Alliance, the Interim Executive Committee. He is the co-chair of it. And also is a member of the Global Commission to End Diagnosis Odyssey for Children with Rare Diseases. With everything that I am mentioning, it helps you get to understand that Mr. Riafe is very, 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 very passionate about advocating for equity and inclusion for people with rare diseases, and for the community to be also get to understand, become involved in its engagement in the healthcare, especially for children, or for individuals with congenital anomalies, rare and undiagnosed conditions, genetic disorders, and chronic conditions and disabilities. So yes, with everything that you have heard, everything you have listened to, who else would be a better person to help us understand what rare disease is? And aside that, who else would be able to get us to know what exactly is involved in including rare diseases, finding an equitable support system for people with rare diseases? Please, we have just started. Fortunately, Mr. Riafe is just about to start. Do tell a friend to tell a friend that it is time, so they should log in and join the conversation. We are also streaming via our YouTube channel on our Parents Professional Connect on YouTube. So if anyone can't join the Zoom, please tell them to just go on to Parent Professional Connect on YouTube. They would be able to get access to that also. So without wasting much time, Mr. Riafe.
Hello, can you hear me?
Yes, I can hear you loud and clear.
Yeah, thank you for the opportunity. And I'm honored to meet everyone. And
We also appreciate the fact that you said yes to us when we came. So we're going to leave the floor to you so you continue.
yeah, thank you once again. As I said earlier, it's an honor and a privilege for me to share my insights and what I know about rare diseases based on the work we've done over the years and some of the things we have known, the experiences we've built over the time. And it's going to be slightly technical. And so please, if you have questions, feel free to ask. My background is in psychology, largely. Now I'm doing public health as well. I've spent a significant amount of my time also advocating for the rare disease community and coordinating several initiatives around rare diseases. So it is in this slide that I will be sharing what I know. We work with Missions Clinic. We meaning Rare Disease Ghana Initiative works with Mission Clinic as one of our clinical partners. And so it's really a privilege. I know that I may be talking to one or two people who may have also been a beneficiary of our program, and happy to get to know you more. So let me share some slides that I put together to guide our conversation this evening. I don't know how this works. This will take me to the entire screen. Please, can you see my screen?
Yes, please, but it's not in presentation mode currently.
Okay. Okay.
That he would become a top candidate, wonderful husband, father.
Okay. So this is very important because we are also within the Rare Disease Month. It's a month.
Mr. Yaffing,
Yes.
sorry,
Can you-
now it is on presentation, but it is showing us you would see or you should see on your screen.
Oh, really?
Yes.
Oh, no. So it's the Is there a way to stop sharing and then I can redo it?
Yes, currently you have stopped.
I'm not the Zoom guy, I'm more of the Teams guy. So, okay. Should be easy. Okay.
Okay.
How about now?
Yeah, so we can put now in the presentation mode. I'm sure this one will work.
Okay.
Kindly use that one at the side, the next one.
This one.
Yes.
Good.
Oh.
Yeah, thank you. Is this still
Yes.
the same problem?
Yes, unfortunately. Okay, please, if it's possible, just share with me and then Goffred can help us out with it.
Okay, I should share the slides with you. Okay. 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 Okay, I just shared. Let's see.
Okay, let me. Okay, Or you could probably, someone just help me out with something. They said you should hit the camera stroke computer looking button below.
No, it's the preview, the slideshow. If you can share it again, Mr. Wiafi.
Uh-huh.
Yes,
Okay,
if you
buddy,
can
I've
you
shared
share
it with you, sir.
again, let's see. No, I mean
I
he's sharing the screen so that at least you can do the presentation so
Okay,
that we clear the preview off.
okay.
Yeah.
so can you see me now?
I think it's still loading. I'm not seeing it now.
Mm. Not getting that option. Is it possible to share from your side, maybe?
So I'm let me do that.
Okay. Okay, so while we wait, I can just, talk about how I got involved in the rare disease space. And for me, was interesting. I going through school, doing reading psychology, we had learned a lot about mental illnesses, but we had not learned that we were going to see people who will be dealing with very complicated situations. Until I met this family who lived with a syndrome. They had, I think, 4 children, and all of them seemed to have some condition that was not diagnosed at that time. And it was very difficult. For me, it didn't seem like my typical patient where you would just see them in the clinic and they go, and that's the end of the situation. But it seemed like you were going to be with this family for a very long time because they always had questions, they had concerns.
Is
And
the screen up now? Sorry.
yes, it's up.
Okay.
Yeah, okay. Okay. So, so now I have to say next to get the slides to move in. Okay. Okay, I just want to know how I can move the slides. Is it possible to move it from my end?
No, so then Goffred would have to be manipulating it for us.
Okay. Okay. Okay, thank you. All right, so I'll just say next, and so that you can move when I want.
Okay. Thank you.
Okay. All right, thank you. Yes. And so, yeah, so
No,
within
sorry,
the-
sorry. You have
Uh-huh.
the control now, so you can control. So the next move was by you. So you can do that now. But that's fine. I can still control from my end here, but to at your own pace, you can also use your mouse or your cursor to control it.
Because it's not moving from my end, that's why I'm
Okay.
trying. Okay. So can you go back, please? At this point, I don't know if I'm the one moving or if it's confusing. Okay. Yeah. And so rare diseases are very difficult to define. As in every location or every country and how they decide to define rare diseases. And so it makes it extremely difficult to decide what is a rare disease and what is not a rare disease, especially if you don't have data. But so it's a general issue, but generally the easiest way to think of rare diseases are diseases that are not common. Diseases that are not common. Diseases that affect a very small percentage of the population. So if you have a disease that does not affect a lot of people, then we are talking about a rare disease. The closest government document that you can find a definition of rare state, like where they mention rare disease, is in the FDA guideline for registering of orphan drugs, which was published in 2019. And in that document, a rare disease is defined as a disease which occurs in a small percentage of the population. And so in Ghana, that's what we have. And in that document, they do not give estimates of numbers to say, okay, maybe if this disease hits this threshold, then it is a rare disease. And so we don't have estimates of numbers to tell which one is a rare disease and which one is not. However, the general assertion is that rare diseases are diseases that have they are usually medical conditions. Many rare diseases are medical conditions, and they have a specific pattern of clinical signs, symptoms, and findings that affect fewer or equal to 1 in 2,000 people. So if you have 5 in 10,000 people, then we are looking at a rare disease. 1 in 2,000, we are looking at rare diseases. Any WHO region of the world. So now you start thinking about the conditions that we see. If you are seeing more of those conditions, if you are seeing more than 1 in 2,000, it is usually not a rare disease that you are seeing. But if you are seeing one or less than that in 2,000 people, then we are talking about rare diseases. Usually when I talk about rare disease, people think it's just one disease, but no, I'm talking about over 6,000 diseases that have been reported globally as rare. And then many more being discovered. In fact, recently in Ghana, we diagnosed a case where the gene was never known to cause a disease, but now the gene causes a disease, and it's like one in few of cases reported around the world, and there was a family in Ghana who were equally affected. And so we have many of those conditions. So there are new conditions that are coming up as well, and all of those fit into the definition of rare diseases. Collectively, if you put all of them together, we are talking about a large group of people who are affected. Globally, about 300 million people live with rare disease. So if you put everybody living with rare disease together, we are talking about maybe the third largest continent, okay, or country, the third largest country in the world. So you can think of it in that sense. The population is big. Most of rare diseases are genetically inherited, which means that their cause or what accounts for the condition is usually due to mutations in the genes, which can come up due to sporadic or de novo mutations, as well as some that have been inherited from the parents as well. Not all genetic conditions are actually inherited directly from the parents, but there are de novo mutations as well that do happen. And some of them are inherited. Some of them are also due to chromosomal changes. And all of those account to cause some of these rare diseases. Most of them begin in childhood. And so majority of our patients that we have supported are children. And most of them may die before their 5th birthday. These are global statistics. We are now even looking at the data available to us and looking at the mortalities. And you can see that a significant number of patients that we have been able to help to diagnose have also passed before they were even age 5. Many rare diseases do not have treatments. And so it's important to know that many rare diseases do not have very few of them have treatments. And for us in Ghana, the treatments are not even available and accessible to our patients. Some of the treatments are really, really in the development stage. They are now experimenting or exploring. We don't know about the efficacy of and how safe some of these treatments are yet. And so these are realistic things that are going on with rare diseases. And so we are diagnosing, but we don't even have treatment for many of these diseases. Some of the diseases, we don't even understand their natural cause. We don't even have an understanding of how the disease will progress over time and all of those. There's little research going on. Okay. We estimate that maybe 3 million people may be living with rare diseases. That's because 1 in 10 people are estimated to live with rare disease. So 10% of our population may be affected by rare diseases. And if you put these 3 million people together in one region, maybe it will be the third region, largest region in Ghana. And so we are not talking, it's not, even though individually the diseases are rare, if you put all the people living with rare diseases together, we are really, really talking about a lot of people. So far, we have documented 200 rare diseases, more than 200 rare diseases, and we are still documenting many more that are coming up. Okay, so these are just few of the rare diseases that have been reported. There are many more. This list is not the full list. This is just few of them. And so we have many more conditions that have been reported as rare and have been found here in our population. So every condition on this list has been a Ghanaian affected. It's been diagnosis of some Ghanaian people. And so this is not a global list. This is not a list we got from the internet. This is a list from our own community and many more that are there. So the gaps that exist, one of them has to do with the knowledge gap. For the medical professionals, like myself, until I met that family, I had no idea that there were rare diseases. And so there are many, many, many more clinicians that you meet, and many doctors, many nurses, many physician assistants, many physiotherapists, many dietitians, many, many of them that if you meet and you talk to them about rare disease and like, what is that? They have no idea what know more about these conditions. There have been some few clinicians that you meet them and you discuss something with a condition with them, and they will tell you that, oh, we read it in a textbook, and to them it was something that does not happen in our setting. And so they even find it strange that we are recording some of these cases in our population. And so our training do not really cover rare diseases. And so we are not really actively looking out for these conditions. And many times these patients show up in our waiting room, our consulting room, and we dismiss them, and they go, and we don't even go further to explore what options may be there for these families. For us in psychology, many patients may be referred in as somatizing or being hypochondriac, faking their symptoms when they actually have a condition. I remember recently, even at Ga East, we saw a patient at the emergency, and we were called in to come and see this patient because the patient's symptoms were not consistent, and the patient was suspected to be using some substance. So we were called in to do substance use evaluation and management for this patient. But when on a critical assessment, we saw that no, the presentation were not substance related. And so, and patient was rather declining, having a lot more neurological challenges. And so we referred the patient back for evaluation, not knowing this patient had multiple sclerosis. And so you could even imagine how multiple sclerosis was mistaken for substance use. And so this is how some of these rare conditions show up, and they get misdiagnosed for other conditions. The other challenge is that the healthcare professionals, like myself, it's sometimes difficult to find information. Sometimes difficult to find resources for these patients. And so that's also a big problem. I remember one time there was a diagnosis for a patient, and I tried to search for information for the family. And all I could get for that was some a very difficult scientific paper that somebody had published on a lab work that someone had done, and probably was describing the gene or something. It was very, very difficult to understand. Not even with my background, I found it difficult to understand such a paper, and how much more a family who has this condition. And so sometimes, even for the rare disease, there isn't enough information available, even after diagnosis. And it's very, very challenging to continue management and care for these families when there isn't enough information and resources available for some of these conditions. I remember one patient's genetic test result came, and the diagnosis was diseases not yet specified. So with this condition, how do you guide the family? Because there isn't information available for this case. Okay. And all right. What's happening? Okay. Yeah, the next challenge. Oh my goodness, what's happening? Please forgive me. We are facing a lot of technical hurdles. Yeah, the next challenge or gap that exists for the rare disease community has to do with the diagnosis. It takes a very long time to get a diagnosis for a rare disease for multiple reasons. As I said, due to the knowledge gaps among health professionals, there's a tendency that you can go to see different doctors, and they will all give you different diagnoses. They will all do all kinds of things before maybe you are lucky to find someone who is able to put everything together and then come up with a hypothesis of a possible rare disease and be able to get diagnosis for you. And so that is a problem. And also many rare diseases seem like you have to rule out all the common diseases as well. So which means that the families have to do all the testings or the other diagnostics to make sure it is not a common condition before we proceed to think of it as a rare disease. Many rare diseases also require genetic testing, and the cost of diagnostics is very, very, many genetic tests are not available until recently that we have our diagnostic access program where many families are able to now get access to genetic tests. But routinely, genetic test is not available in our healthcare system. There are few labs that are now trying to commercialize genetic tests, but it is very expensive. Genetic testing is not cheap. It's very, very expensive. So many families cannot afford these tests, more so because many times they have already spent all their money doing other tests that when genetic test becomes the next option, they usually do not have money. We don't have newborn screening. Newborn screening has shown to be very efficient in diagnosing some of the patients on time. But in Ghana, we don't routinely do newborn screening. I know there was a newborn screening program for sickle cell, but that is only one of the genetic conditions. There are many more that we could potentially screen for and intervene on time. I know a case, for example, I think galactosemia, that a patient just needed to stop taking milk, dairy products. And so such a case, if we have newborn screening for such cases where the treatment is just about stopping certain foods and certain products, it can help the family so much. And so, but we don't have newborn screening routinely in our clinical settings. And so many families do delay on diagnosis and getting diagnosis. And so a big chunk of families also remain undiagnosed. We've managed to diagnose quite a number of patients through our program, but still a bigger number exist who do not still have access to diagnosis or have access to treatment. So have access to diagnosis and testing. So that is a huge gap. We have few specialists, few centers. We've managed to advocate and have a lot of doctors now who are interested and passionate about rare diseases and are really, really doing an amazing job, like Dr. Mabel, Prof. Bedu, Dr. Brew, Dr. Daniel, a lot of doctors, Dr. Sean, so many of them Dr. Esla. We have quite a number of doctors now who are very, very committed to the rare disease community. But there are many more doctors who have shown interest and are building their capacity in the space as well. But there are many more who do not know about rare diseases as well. And so we are making progress. There are now some hospitals like Missions and other hospitals now that you can go and get some diagnostics, some tests available. And through the Rare Disease Ghana Initiatives diagnostic program, we are able to cater for some genetic testing for some families. But our capacity is still small. We still can't cater for every patient in Ghana at the moment, but we still are able to provide some help in that way. And so it's still challenging. Diagnosis is a huge problem. Aside diagnosis is the treatment. As I said, many rare diseases do not have treatment. And about just 5% of the 7,000 rare diseases have some treatment available. And most of these treatments are not readily available to our patients here. Many of the treatments are in developmental phases or are in trials, and we don't have clinical trial running here in Ghana easily for patients where patients can enroll easily. Many of these treatments are very, very expensive. We try to get treatment for some patients with Mokio syndrome, and the cost of the treatment alone for just 1 year, it's not small money. We try to get treatment for some patient with spinal muscular atrophy, and the treatments are so expensive. And so you wonder, and many of these treatments are not currently covered on insurance, and they are not on our essential medicine list. And so it's difficult to get access to these treatments. So we are still doing a lot of advocacy and to see how we can bridge the treatment gap, but it's still a big problem. It's a huge problem. Aside the drugs, many rare diseases may require other supportive treatments, physiotherapy, diet therapy, speech and language therapy, behavioral therapy, and other forms of therapy, which all add on to the cost of treatment. Surgeries, a lot of patients undergo different kinds of surgeries for their condition, and all of these treatments are mostly not insured, and patients have to pay out of pocket. And it can be very, very challenging. For patients in rural areas, it can be it can be very difficult and more difficult for most of these families. So this brings a lot of psychosocial and mental health problems for these families. And the families usually go through a lot of stress, a lot of anxieties, a lot of frustration, a lot of burnout, fatigues. We have encountered so many families who have been suicidal, some with depression, some with PTSD, and other forms of mental illnesses that is comorbid with the condition they have. And that makes the journey even more difficult because they also have to now get treatment for the mental health situation they find themselves in. In our setting, we have rare diseases are highly stigmatized, and more so because due to delayed in diagnosis, sometimes the family has one or more children with similar conditions, and community may begin to ascribe other spiritual connotations to their condition, and it can be very, very challenging. And there are a lot of abuses that sometimes happen in a community level. We had a patient who was almost killed for having one of the rare skin condition, ketosis, and someone almost killed the child, accusing the child for being the cause of the community's problems and all of those. So these are all the kind of things that goes on, and we call these children who have rare diseases, all kinds of names, and attribute all kinds of things to them, and do all kinds of things. Also, for many of the caregivers, they are unable to work. They are not able to keep their jobs. They are not able to, because they always have to go to the hospital, have several appointments with different specialists and all of those. And so it makes even working difficult for them. And this also further move them into the financial challenges. And so the cost of care is very high for many rare diseases. They are paying for the most expensive services in the facilities, in our healthcare systems. They are paying to do all the expensive labs, all the advanced diagnostic tests. They are paying for the cost of doing genetic tests alone. For a family, if they have to do a trio whole genome sequencing, it's going to cost them almost $10,000. It's going to cost families so much to even get to know, just to know what is wrong with their child. They do all kinds of tests, and this gradually moves them into the poverty line. And so I've seen people who are doing well financially, but had one child with a rare disease, and then they had to now pay in a week. You pay different specialties who have to see your child, and different interventions, different therapies. And aside that, you have to take this child to a special needs school, and the special needs school, most of them are very, very expensive. So it's a huge economic situation for the families, and it is very, very challenging. And so we require a lot of advocacy to bridge some of these gaps in there. Until recently, I've been able to put together some data around rare diseases, but we still don't have a national registry for rare diseases in the country. The data we have collected are from few centers and the doctors we work with and all of those. So it's still a gap in the data. There isn't much research going on rare disease, even though we've supported about 3 researches to date. There isn't active research going on for many rare diseases in the country. And this is due to the fact that individually, the diseases are very few patients are affected. And usually it's very small to estimate sample size, get a needed sample to even initiate a research study on these people and understand their conditions very well. And so it's not also more like interesting to study when you don't have the numbers. And so it makes it difficult to research in this population as well. But data is a huge problem, and we hope that we'll be able to bridge it one day, but it's really, really a gap. So we usually encourage the families to contribute when the opportunity comes to data and to research, because it helps for us to understand the conditions, and it helps to also understand many of these diseases. The natural cause is not known. It's not like many common diseases that we really understand these conditions. So we require a lot of research in this space to understand these conditions. Yeah. So this is just a pictorial view of how the journey is. It's very complex. What you are seeing here gives you an idea of how someone with a rare disease typically goes through their day. Very, very complex. They may be on a journey and they have to return back to square one to start again and go maybe hit a block, come back, and all of those. So I will not take my time to walk through this journey, but this is like very, very complex journey of a person's going through rare disease. So for us in rare disease, what does inclusion mean for us? When we talk about inclusion, we are also talking about equity. We are not just saying have us on the table or just mark us as present, like people do. But no, we want these conditions to be seen. We want them to be heard. We want them to be valued, and want them to be supported. That's what inclusion means for persons living with rare diseases. They are neglected, they are isolated, they are pushed, they are thought of as not important, non-existent. And so we need to, thinking about rare diseases and inclusion means that you have to think of it as in existence, as in visibility, as in understanding that there are people actually living with this condition and they really have a voice. They really have an experience that needs to be valued. They really need to be listened to. Okay. They need to have a name for their condition. And that's why we are investing a lot. People, I was having a conversation last time with a doctor, and like we mentioned, a genetic test for a family will cost roughly about $10,000. And the comments were, why are we spending this money on conditions that will not have treatments? Why don't we share the money and spend the money or give the money to some other conditions that could get treatment? But no, in the framework of inclusion, they need to have a name. Many families have seen reliefs from knowing what exactly is wrong with their child. There have been a lot of relief for those families. Okay. They need to have access to quality care. We need to strengthen our healthcare system so that they can deliver the care that they need. We need to be able to attend the school without fear. We need to fight for inclusive education systems. We have a patient who had a Mokri syndrome and was going through school and at some point almost dropped out. BC. So we had to intervene, got them a wheelchair, and then got the child to be able to ride a BEC. And now the child is in the secondary school now as I'm talking to you. And so the child needs to be able to assess, everyone, irrespective of your condition, needs to be able to assess the education. They need to be able to, it's not just about healthcare, but they also need social care as well. They need to be part of a community. And they need to feel that they also have their human rights being respected. This is what it means for a rare disease community. This is what it means. They also need to be valued as humans, as people. Okay. But there has been gaps, there have been barriers that have impacted. I've already talked about some of these already, so I'll not go. But the main thing has been the knowledge, because we are not talking about rare disease. Many of these families are even hiding. Even after diagnosis, few families come out to talk about their condition, their condition, and are confident enough to even talk about their condition. Many still retreat into hiding, and if we don't make noise, people still believe these conditions don't exist. I showed you a whole list of conditions that are rare, but we don't know. You can't see these families because they are still hiding. And so there's still lack of awareness, and that also impacts inclusion because people still don't know that there are people living with rare diseases in Ghana. People have Gaucher's disease. People have xeroderma. People have epidermolysis bullosa. People have different rare diseases in Ghana. We are not seeing them. We are not talking about them. They are not sharing their stories as well. There's infrastructure gap. No genetic tests. I've mentioned this already. No registries. Few specialists and centers. We are lucky that now we can boast of some doctors who are very passionate about rare disease, but until then it was very limited. Okay. I remember in the beginning, I was always knocking at Prof. Bedu's door, always bothering him, because to me, it was just a few people I had seen documenting rare diseases, and even in the literature. I think Dr. Ameyaw as well at Confanoche. A few people talking about rare diseases and actually writing or even showing that there are rare diseases. And that was a challenge. But now, at least we have a lot of doctors now, a lot of doctors who are specializing and having interest in rare diseases and building their capacity. There's still policy gap. We still don't have a national rare disease policy. There isn't rare diseases are not included in the insurance. Recently, the government launched the Mahama Care and all of those. And when you listen to the discussions, the rare diseases are usually not considered in all of their activities. So we are planning to engage them to ensure that there's some inclusion in some of these interventions that are coming up. The myth, the misconception, and also makes the family's life more difficult for them to bear. And because of that, it also impacts inclusion as well. So as we talk about inclusion, we need to start looking at these barriers as well and bridge them in whatever way we can. And I know I'm talking to some people who join me in this fight and advocacy for rare diseases. If we don't do anything, we can choose not to do anything. Problem is that if we don't do anything, there are a lot of children who are going to be born with the same conditions or worse forms of the condition, and we still don't have the system to manage them. I wouldn't say that rare diseases came because we started doing rare disease advocacy, and that's how we are seeing more rare diseases. No, rare diseases have existed and have been with us. And if we don't do anything, there will be still many more people who will be born and many more people who have rare diseases. And still the system is not set up to meet their needs. So there's going to be more burden. In addition, those that we have identified, their condition will get worse and we will not be able to do anything for them, and then their condition gets worse and then they may die. We are also going to see a lot of inappropriate behaviors and inadequate support for family members and the community. There wouldn't be much support in the community. There wouldn't be much support for the families that are affected if we don't do anything, if we don't take an action. We are going to see a lot of abuses. We have seen a lot of abuses because these families are vulnerable. People physically abusing them, emotionally abusing them, financially abusing them. There's a lot of exploitation going on. People going to these spiritual healers and taking their monies and abusing them in the process and leaving them back into the healthcare system and not being able to support them, make them feel they are the cause of their conditions and take them through all kinds of things. And meanwhile, they are dealing with a genetic condition, and some people just take their money and they don't have money to even continue care because someone has taken that money. One thing that I'm seeing and I've seen is that many of the patients also lose confidence in the healthcare system because they keep showing up and we are not able to give them the answers they need. They give up. And so they lose confidence in the healthcare system. They lose trust for the healthcare system. And so sometime if you're able to offer answers to them, they've already lost confidence for the healthcare system. So we need to really, really take actions, and through that we'll be able to. And these are some of the strategies that we have put together, or some of the key recommendations that we think are very, very important. I will not take, because of time, I will not go into it, but these are some of them. We need to continue making a noise, continue talking, continue creating awareness, educating our healthcare professionals, policymakers, and the general public like we are doing now. It's very, very important, and I commend Mission Pediatrics for this effort. And I know we work with other doctors who are also doing wonderful work. We need to continue doing and pushing this. We need to do that. It will help us a lot. We need to improve access to genetic services. The West Africa Center for Genetic Medicine is training some genetic counselors and all of those. We need to make sure that these services are available and accessible to our patient. We need to have access to newborn screening, prenatal screening methods. Okay, some of the condition you can even know before the child is born. And so we need to invest in these services so that it can help us know ahead of time and plan ahead of time for this family. We need to enhance our data surveillance. We need to ensure that our patients are adequately engaged and they are participating in their care policies and research. We don't want the patients to just be receivers. That is not something we believe in. We want them to be active participants or partners in their care. Because the truth about rare diseases is that most of these diseases are very novel, and we don't really understand these conditions until these patients who have the condition tell us their daily, everyday challenges and what they go through. To the best of my knowledge, we have one patient with, say, the Chantonawi syndrome in the whole country. And if we want to understand the Chantonawi syndrome, especially from the Ghanaian perspective and within our setting, we have to literally pay attention to this particular patient so that we will understand how this condition progresses over time. And so, or if how someone lives with this condition and grows with the condition, that understanding is very, very important. And we need to ensure that these patients have access to adequate therapies. And then we need to keep pushing the government. Different governments will come. We need to keep talking to them. We need to keep engaging them and to ensure that they are fully committed to the promises they make. And not just the promises, but ensuring that persons living with rare disease also enjoy their basic human rights. Health is part of their rights. And so it is not something we need to negotiate about. Okay, everybody needs rights to their health, and we need to make sure that the government is providing that right to the people who are affected. Okay, so there's been some hopes since 2019. There's been a lot of work going on globally. Rare disease was included in the Universal Health Declaration. In 2021, the UN passed a resolution on persons living with rare diseases. And in 2025, the World Health Assembly passed a resolution for rare diseases. But Ghana, as a country, we still don't have a national plan yet. And so a lot of the work is being championed and led by Rare Disease Ghana Initiative. We have been engaging different stakeholders to make sure that we get a national plan for rare diseases. Last year, we held a forum with the Ministry of Health and had a discussion at the Ministry of Health during our Rare Disease Day activities to pushing for a national rare disease plan. And we are hoping that we'll be able to have it drafted and developed soon for the country. Okay, so I'll take the next couple of minutes to just share with you something about Rare Disease Ghana Initiative. We are basically a non-profit organization. We are an NGO made up of volunteers, a lot of volunteers, and professionals, patients, caregivers, different people. We have journalists, we have different people who have come together, and our belief is that we can advocate for persons living with rare diseases. Our mission is to improve the well-being and the quality of life of persons living with undiagnosed genetic and rare disorders in Ghana. And our vision is to be the leading organization for the patient, caregivers, health professionals, and researchers, serving as a voice and working towards a Ghana where every individual and family living with undiagnosed and rare disease have access to diagnosis, treatment, and a supportive community. And we do this through education, awareness, advocacy, care coordination, and support we improving data and advanced research and building and empowering in our community. These are the areas that we are heavily focused. Over the years, trying to build networks. We've built a network for families who live with rare diseases. And so we encourage many families, if you don't have a support group for your disease, to join our family network, because it's a network which is not disease specific. But when there is a disease specific, we work with other disease specific organizations like the OI Ghana, Down Syndrome Ghana. There are sickle cell groups we work with. Recently there's a new group for primary immunodeficiencies that is being established. And so when there are disease specific groups, we come together, and that's where we advocate together as a coalition, which we call the Genetic Alliance. And then we have our clinical research network for our clinicians and researchers who have passion and interest for rare diseases. And we are now building our corporate alliance as well. We are still working on the corporate alliance for the industries that are focused on rare diseases, to make sure that there's some kind of a sustainability plan for rare diseases in Ghana, to get full commitment from industry for rare diseases. And so these are currently the networks that we are built and developing under rare disease. And we work with different stakeholders. So this is just a map of all the stakeholders that we work with, from the patients to the healthcare professionals, to the patient organizations, to the academics, to the policymakers, to the different stakeholders that we engage to ensure. And our programs have been grouped into let's say 2, 4, 6, more than about 7 programs that we run currently actively. One is on the awareness and outreach programs like we are doing now, Rare Disease Day. We also do a lot of training programs like webinars, symposiums, and other educational initiatives through this program. We also have a diagnostic and screening programs, which many families have benefited from, where a clinician suspects it's a rare disease. They reach out to us and we help to cater for the genetic test for those families. We have a new program that we are piloting, which is called the Digital Health and Innovation Program, where we are exploring how innovations like AI and other technologies could be useful in diagnosing and management of rare diseases. We also have a new program that we are also launching, which is the regulatory and the patient safety program. Since many of the rare disease treatments are in the development phase, we need to ensure safety for the patients. And so we have a program that we are launching, which is called the Regulatory and Patient Safety Program, where we hope to work with regulators to ensure that the treatments that patients are getting are very regulated, and they have enough information to also make decisions on the treatments. And we have another program called the Data in the Registry program, where we are building a registry, a national registry for rare diseases. And so we are working on that as well. So that program focuses on that. And we have the well-being and empowerment program that focuses on addressing the social aspect of the lives of the families. Through that program, so we're able to assign care coordinators to patients who need care coordination and make sure patients have care planned. And then we have the therapeutic and device access program, where patients who need access to some specialized devices are able to get access. So through that program, we've donated like stoma bags to some hospitals for patients who require colostomy bags for their care. We have also donated some wheelchairs to some patients, and so these are some of the programs that we have So our model for inclusion now focuses on awareness and advocacy, and then access. So these are the three areas that we look for when we are talking about inclusion. Has to do with awareness, advocacy, and access. And so we are working with different clinical centers in the area of access and ensuring that we have some referral pathways. So right now we have about 20 clinical centers that we collaborate with across the country, which is very, very impressive. And so now we can confidently say that we can refer patients to any of these clinical centers, and there would be care provided for these patients in those centers. Okay. So these are some of the key achievements we have had as an organization, and we have also reached over 500 healthcare professionals have been reached. We have reached more than 500 families. As I mentioned, we have 20 clinical centers now, more than that, and more than 200 families have received diagnosis. Actually, we've documented over 200 rare diseases. We've supported about 8 surgeries, and currently about 7 patients are on some life-changing treatments, and supported some research projects, 3 research projects. So why are we doing this? We are doing this because we want to be able to help to achieve the Sustainable Development Goals. We cannot achieve Sustainable Development Goals when we are excluding some people, on the basis of their health. It's not fair, and it's not the best, and it will be difficult to achieve the SDGs. Specifically, looking into rare disease, we are talking about 7 of the SDGs. If we don't cater for rare disease, as I said, there are families who are gradually getting into the poverty line because they have to pay huge sums of money for their health. And so every day that we have not done anything about rare diseases is some family gradually moving into the poverty line because of their condition. And largely because they cannot work. Even the parents cannot work because they always have to be by the children, take them to hospitals and other things. I see a lot of families, those who are even working, getting out of work due to the conditions. Good health and well-being. We need to ensure that those who are affected have good health and well-being. So we need to invest in the rare disease space for these purposes. And we need to ensure that we have universal health for everyone. And okay, I don't know, but it seems. Yeah. We are promoting universal health, and we are ensuring that no one is left behind, which is in line with the SDGs as well. And so we want to make sure that no one is left behind by including rare diseases. By including rare diseases, we are ensuring that nobody is left behind, not on the basis of their health condition. We're also helping to achieve the World Health Assembly's resolution on rare diseases. Especially if Ghana takes action, we will be moving towards achieving some of the steps in the WHO resolution for rare diseases. So, in the nutshell, we are instilling some hope. We are making sure that some family can have some hope, because the condition may be rare, and rare is everywhere, but hope is not rare. If not anything, we can all put our hands together and ensure that there's some improved systems, the little we can do to ensure that we can achieve some hope for the family, for the people, we can do that. So on this note, I want to thank you so much. I know it's been a long talk, and if you have any question, I'm happy to answer them. But we are ensuring that everyone who lives with a rare disease can have some hope. And I hope that you will join us to provide hope for this family. Thank you so much. If you have any, if you want to reach us, these are address to our office, and then these are websites, these are emails, and then phone numbers that you can contact us anytime if you have any question or any information. I really appreciate you for your time and for taking all the time to stay with us through this. And thank you very much. Thank you also for Missions Clinic and Mission Pediatric for this opportunity. And I continue to look forward to our collaboration and partnerships and continue to support many families who come to your facility and may have a rare disease. Thank you once again. Bye.
Thank you so much, Mr. Riafe. Thanks a lot. So yes, as you can see, with all the applause, the reactions, it goes a long way to say that we are grateful for you taking the time off. I know it's a busy time and a busy period, yet you've made the time to be able to join us. Thank you for that. Yes, we are not done. In case anyone has any question, comment, concern, anything at all, please, you can raise your hand, you would be called, and then we would continue the conversation. You can ask all your questions that you want to ask. Mr. Rafa is here to help us understand anything that we may have left out. So yes, I see people showing appreciation. Jennifer says thank you. Krantema is also applauding. Zoom user is also saying thank you. Betty Nkanta also says thank you, Mr. Riafe, for your wonderful presentation. So yes, please, you can keep on showing the love, just as some of you use the reactions to show so much love to Mr. Riafe for taking time off to help us understand this. And as he mentioned, rare diseases have been here with us for a long while. We may not have known. Now we are getting to know, we are trying to understand. So as we understand, as we gain knowledge, there are several support systems that may be needed to assist a child who has this condition. So one of them that he mentioned has to do with speech therapy. Yes, it's not just speech therapy. There could be other things that the child would need, like occupational therapy, behavior, and all that and all that. That is why one of our departments, our speech and language department, has also decided that it would keep on going in training, not just the teachers, but helping the schools and the children get to understand, especially with the facilitators, know how to support the children who have communication difficulties. So please, if you have an interest in it, if you would like to get to know more, you can reach out to Mission Pediatrics. If you do not know us or you do not have our number, I am going to mention the number to you so you can have it. And the number is 024 724 1447. Please, I would take it again. 024 724 1447. You can reach out to Mission Pediatrics and then get to have the schools that are interested sign up for these training sessions, because they are there to support you as facilitators be able to help our kids that we work with. There are some things that we may tend to think that, oh, this one, yeah, it is normal, or this one, I don't think it is an issue. But please, just as Mr. Riafe said, it takes time to be able to diagnose and find something. So the earlier we start searching for support, the better it is in getting the help also. Meshakte says, thank you for this presentation. Amate Atram also says that very insightful and informative presentation. Bravo. Call Me D says, Prof. Oh, okay. Prof. Anyani Yeboah is available to make comments. If you'd like to make a comment, please, you can just put up your hand. Okay, yeah, already has a hand up. Yeah, please, you can unmute yourself and then share with us. Yeah, you've been asked to unmute, so kindly unmute and then ask your comment.
So much. Thank you so much, Sariafe. I have, I didn't see because the texts were a bit smaller on the list of rare diseases. BBS. I may get the pronunciation wrong.
Biedl syndrome.
Good. So I have three such kids in my school, and you know their situation is very regressive. But one thing is showing like signs of like we really want to learn and is pushing hard. But the site, I've gone around looking for help, like because with time they can't really see, and the older one is actually not seeing very well. So some of the subjects he struggles to come along, and I've gone around. I've been to University of Ghana, Braille. I don't know where to turn to. If there is help for such kids, I mean, so that they could still continue to learn. And then our what do you call it? DEC, the standard and the opportunities they give to children with such challenges is very limited. I don't know how best your team can also support such kids to get the exception. They have some exception, but it doesn't cover these kids with their challenges, so that they can grant those exceptions so that these children can sit to write the exams. I believe knowledge is knowledge, whether it's oral or written. I don't know whether they can take it for the kids to write DEC, stuff like that. So if you can assist us and get help for them, especially with the site, and then their BEC looking forward. Thank you so much.
Thank you, yeah. Mr. Rafi, would you like to comment now?
Oh, yes, I don't mind. Yes, so it will be very important. So for us, we also depend on the assessment. So like you need a clinician to give us like a full assessment and like to be able to identify the specific needs, and then we find the right expertise. We are part of a global network. Prof. Anyane Yeboah is also on the call, so he might be able to comment on those things. But there are a lot of, we are part of a global network, so I could find answers and resources where needed for that case. Yeah, and so in terms of the clinical care aspect, in terms of the disease condition, the management of the condition, we would want to work with the doctors in charge of that case to see what is feasible and what can be done, looking at our local case versus what resources could be mapped from the international side. The other side, the other comment has to do with the educational needs, which is the helping them to achieve their academic goals. That's something we are very interested in pushing. We are trying to talk to schools and to so one of our activities that we do for Rare Disease Day is even called a school event. And so that's first we need to create the culture of acceptance and inclusion within the schools first. And then secondly, by training, and as we do that, the teachers, even within the schools, the teachers have to be more receptive and understand the needs. And then from there, through advocacy, we can get them included in the inclusive education plan or whatever the case may be. Usually, it's very easy for us to send a letter to, say, the Minister of Education or the Ghana, the West Africa Examination Council, when we have all the medical evidence suggesting that this patient will not be able to sit and write for a written exam or something. That is, we can do that. We can send letters to people, attach their medical evidence that they are not able to do that. And so based on that, they should be able to assess differently and all of those. So these are things we can do and we are willing to do.
Exactly. So I think I have just asked Prof to unmute himself.
Hello?
Yes,
Can you hear
Prof.
me?
Yes, please. We can hear you. Kindly go on.
Yes, I'm very pleased to be able to join this group today. I'm speaking from the United States. I have been working with this group. I give you credit, Sam and everybody, credit for all of this. You are ahead of a lot of the groups that I know about. I have been a geneticist for over 40 years, and I have dealt with rare diseases even before they were called rare diseases. Many of the conditions that you talk about, I have many patients, with those, conditions. I'm kind of semi-retired from Columbia University now, and I spent time in Ghana. I was in Ghana for 3 months, the last 3 months of last year, and I will be back in Ghana also. But I would love to talk to any of the professionals or any of the families. If you have a new diagnosis, you talk about Gaucher. Gaucher is not common in Ghana, but here, because it's a very common genetic disease we see in the Jewish people, it's not a rare disease. The Shinawi condition, I have had patients with that. Most of the conditions that you discuss, I have managed patients with these conditions. And I can't get you resources in the United States because the patients in Ghana, or the parents and families, should be very, very grateful. The kind of testing that is available to you in Ghana is not available to many of our patients in the United States. And you have to, it's all due to the effort of this group, Mr. Yafe, Ajay Yafe, and everybody included. And I'm amazed at the advances that you have made. How can I help you? If you have a child and you need to talk to a clinician, I'm a clinician. I've worked with many, many, many families for many years. So if I'm in Ghana or if I'm in the United States, you can find me on WhatsApp. You can contact me through Dr. Riafe. If you send me a message, I'll call you back. And, if you want to chat, you want to ask questions, I'll be willing to help you. I also want to actively participate when I'm in Ghana. If we can set up special clinics, I'd like to see, I've seen a few patients, in one of the clinics, and I'm willing to do that anytime I'm in Ghana. So I will send my in advance my next visiting dates, and if we can set up and people want to show up in person, you want to bring your child who has not been diagnosed or has been diagnosed but you need information, I'll be glad to talk to you. I do this as a volunteer. I won't charge anybody a cent for all the work I do in Ghana. Thank you.
Thank you so much, Prof. Anyane Yeboah. That's the reason why this program is teamed Parent Professional Connect. Parents, people who need support, we all come here to share ideas with our professionals. And yes, we are here to bring our professionals to you so that you can have support. Be it being a school, being whatever you are. we get to have such distinguished individuals. And yes, through someone's connection, you get to have support. So thank you so much, Prof. Ayane. And definitely, with Mr. Riafi, every time we call on him, he is always willing to assist us in whichever way. We are grateful. I think I saw a hand up before I start reading the comments from our page. So yes, the hand up was Femo. Please, you have been asked to unmute. Kindly do so.
All right, thank you very much, and I'd like to thank our presenter for that beautiful presentation. My question is about, he said they are a global network. I'd like to know how global they've gone, because until I joined this mission group, I never heard of some groups, I've never heard of some initiatives that
Of the
people are
rare
taking.
diseases.
Yes, not
Okay.
just rare diseases, like initiatives you people are taking to help even people with different kinds of diseases and conditions. I've never heard it. And I work at a hospital here in Ho Teaching Hospital. And we have a social welfare unit that deals with children that are having this kind of diseases, and children that have gone through abuses, and then they don't have families, they don't have support. And social welfare has to fall on some organizations, banks, to support. So how can places like my hospital, the doctors, the social welfare unit, how can they get to know you? Is it possible you can create more awareness by organizing programs that you move to these facilities so that they will get to know you and know that yes, there is help and there is hope for this kind of people? That's my question.
Thank you so much, Femo. You know, as you were asking your question, I was smiling. I was smiling because last 2 years, our webinar for February also focused on rare diseases. And the very moment we called on Mr. Riafi, he was so glad to help us with it. So yes, there are several organizations or several initiatives that are around, but sometimes we do not get to see or even hear of them. That's the reason why we have some of our, not some, but we have all these webinars that we've held in times past on our Parents Professional Connect on YouTube. It is there for you to share with others. So we always encourage you, please, you can like it, you can subscribe to it, and please share the link with others. Because in this our space, we always need to be abreast with what is going on. We cannot learn yesterday's things and apply it today. It doesn't work in this our field that we are in. So please, we would keep trying. We would keep trying to help others get to learn more. So whenever you receive a link or a webinar information, please share it with others, inform others, tell them about it. Just tell them to join. They can also go on our YouTube channel, Parent Professional Connect, and then they can get to watch all previous ones that we've had in times past. And yes, as earlier mentioned, every fourth Sunday, the fourth Sunday of every month, we do have the constant. So people can keep it logged on your calendar that the fourth Sunday of every month, we would be having a discussion. Next month, we'll be talking about neurodiversity, and our focus is going to go on Down syndrome. So please tell someone to tell someone, tell your network, tell everybody, let them all come learn, because next month we're going to tap into the experiences of our parents also. And these professionals that we get to have come here, they are here for us. They want to help us get to learn because we want to bridge that gap. So help us be a link to others too. And whenever there is a need for something, please do let us know. If you're on our WhatsApp community, you can share it with others also, so they also get to learn, join, and be part of it. Now the world is a global village. So even with Prof being all the way in the United States with the time difference, he's still able to join us today through Mr. Riafi. So
And I have to add that my last station where I worked as a doctor before I left Ghana was at the Ho Hospital.
oh
Okay, which is not too far from my hometown, Anum. And it's been such a long time that whenever I visit Ho, all my colleagues have disappeared, So if the speaker will, next time, I will pay a special visit if they invite me to come to Ho. It's only an hour's drive from my hometown. Okay.
Oh,
Right. So I would love to see some of those, children. Every time I'm in Ghana, every year when I come to Ghana, I visit Ho because I still have friends there. I left Ho in 1973. I don't know how many of you were
wow.
born then, but
Not me.
so but I still come there, and I'm still working. I'm still working part-time as a geneticist. Next week I'll be working in upstate New York in a hospital called Rochester Children's Hospital. They have a rare disease program too, but I work there for them because they don't have enough clinical geneticists, and I go there to work part-time. But I will be in Ghana sometime, probably closer to the end of the year, maybe December, January, time, frame. So I wouldn't mind coming there. I have enjoyed this section very much. Dr. Wiafi and I, speak periodically, but I like to also to make sure that the families on this platform know that I'm an experienced geneticist. I have trained a lot of geneticists myself. I have done work for the U.S. Army. I've trained their geneticists. I've trained quite a lot of geneticists who are practicing in the United States. So I'm willing to see children, and I'm willing to participate in whatever capacity that I can. Thank you.
Thank you
Yeah.
so much, Prof.
I want to also provide some answers to the question.
Please go ahead, Mr.
Yeah.
Wiafi.
So in terms of the global reach, I think in the rare disease space, Rare Disease Ghana initiative is very connected. We are a member of the Rare Disease International. We are a member of the International Rare Disease Research Consortium. We are a member of the Undiagnosed Disease Network International. I serve on the Global Commission to End Diagnosis. And we are also a member of the International Alliance of Patient Organizations, and member of Global Skin. We are a member of the Africa Rare Disease Alliance. And so there's a lot. We're also a member of the Global Advocacy Alliance of Global Skin. And these are like the bigger consortiums within the rare disease space, and we are all actively involved in their activities as well. So globally, we are pretty well connected. Specifically, we work with Ho. Ho is one of our clinical sites. We see patients at Ho. Dr. Daniel is on the call, and there are other clinical team members in Ho who we collaborate with. And so Ho is one of the Ho Teaching Hospital is one of the places where we've seen quite a number of patients as well. And so we are actively involved in Ho. We were in Ho for the Pediatric Society meeting, and so we are pretty close to the Ho Teaching Hospital. So be rest assured, as long as the patient shows up and our team is informed, we will certainly be happy to help, depending on the needs available at that time.
So, Famo, please be assured that you are in good hands. You remember Mr. Wiafi shared his the Rare Disease Ghana and then how to reach them. Even his personal details, some of them were in there. So you can, yes, we would share the link to the YouTube channel that would have this particular webinar, so you can have access to it, and then you can keep sharing, keep learning. we are always supposed to learn. So yes, let's go ahead. Let me read some comments from our chat box since we don't have any hands up currently. So Ivy Stell, I don't know whether it's Ivy Stella, says that given Ghana's limited health financing space, what realistic pathway do you envision for integrating rare diseases into NHIS without overburdening the system?
Well, before you answer that question, if I can make a comment. Can you hear me?
Yes, please.
Yeah. Okay. One of the things that is common to all people with rare diseases is that there's a variation. Some of these conditions are very rare. I have published a lot on some of those conditions, and there may be very few people. So it's not unusual that even in the United States, that people may think there's money, a lot of money here. People with rare diseases always have to fight to get, the attention that they need. Okay, because insurance companies, it's not infrequent that I'm required to write a letter or to talk to some insurance company because they've never heard the name of a syndrome. Okay, and there's also variation in the syndrome. Somebody mentioned Bardet-Biedl syndrome. Bardet-Biedl syndrome, there are probably now maybe about 10 different types. Okay, so there's a lot of variation and there are a lot of different severity. Okay, variation in severity, variation in frequency. And some of these people are in rural areas, just like in Ghana, where they don't have access to much information, where they have to fight insurance. So worldwide, every person with a rare disease has a hard time. The schools don't understand it. Social workers don't understand it. And so education has to be given not only to parents, but the parents, you may find that the parents are even more educated than the doctors who take care of the children, and also more educated than the school principal or the teacher. So the parents have to be prepared themselves to be educators as well, because they have kids with this and they learn, they know more about it. And so they should not hesitate, to share their knowledge with the people. When I next time come to to Ghana, I would arrange with Dr. Yafi that on one of the clinic days I could meet them in Ho, and we can have a conversation with anybody over there. But yes, there is a shared bond between all rare disease, people globally, because the same things that we are talking about in Ghana are things that probably nobody is talking about in this country, because they get lost in the morass of all the different genetic diseases. People know about sickle cell, they know about cystic fibrosis. In here they know about Gaucher, Tay-Sachs, and all of those disorders. But very few people have heard about many of the other Shinawi, syndrome, and so on and so forth. Okay, so I think this is going to be an ongoing struggle, and we as a group have to teach everybody that we can find who is willing to listen, including the politicians.
I agree, including the politicians. Mr. Yafi, please, you wanted to make a comment.
Yes, and the funding model for rare diseases is very complex, and this is because there are different diseases. As we say, there are some diseases that are well funded, and for example, hemophilia, for example, is pretty well supported. And so I think that we need to continue to engage. I think with the introduction of the Ghana Medical Trust Fund, maybe if there's discussion, for example, to see if there's an opportunity to have a dedicated fund for rare diseases. That's what many countries do, is to have a dedicated fund for rare diseases. And so we just need to engage and see which is feasible. But if we have a dedicated, because the moment the rare disease fund mixes with other conditions, the tendency is that is going to be used for other high priority
Yeah, that's
conditions.
true.
So what happens for many countries is that they set up a dedicated fund for rare disease. But we need to encourage for the inclusion of some of the aspects of care for the rare disease to be covered by either the national health or the private health insurance, whichever the case may be. Some insurance to pay for some aspect of the care can ease the stress on the families as well. And then some philanthropic models as well have shown to yield some successes. We can look at it from how we've been able to provide the diagnostics for many of the patients. The treatment could also take similar approach where we look at it from a philanthropic model where some philanthropies can come in and say, okay, we are making this fund available to cater for this number of patients, treatments, and all of those, which may be useful as well, but sometimes quite unsustainable, but it's also helpful in a way. So it's a very complex situation, but there's been some successes. We can look at Singapore, Malaysia also. Singapore and Malaysia, one of them have a very good case that we could look at where they are reimbursing treatment for some selected rare diseases. Not all rare diseases, but they still have some reimbursement, some rare diseases. And that. So we may have to start from some and then gradually
we'll keep going.
It still largely depends on data as well. And so that's why we data very well, because to do the reimbursement means that you need to have the medicines and the devices on the essential medicine list. To have those devices and the medicines on the essential medicine list means that you need to do what we call health technology assessments. And if we are not gathering all of those evidences to help make those informed decisions around health technology assessments, it means that you cannot get those products on the insurance essential medicine list as well. So, as I said, it's a complex space, but we have to keep talking around it, and we'll figure
things out. Exactly. So yes, we would need to talk and then we figure things out. That's why the conversation isn't going to end here. We would keep it running, at least just as we do with our webinars. Even after this, we'll keep talking about it. We'll keep sharing tidbits from what we've gathered today with our audiences. And so, Amele, the comments about knowing the names of some of these rare diseases, I know that Prof. Anyane Yeboah and Mr. Riafe have been able to mention quite a lot. I am not going to try and pronounce any of them currently, but we will keep sharing some of them with you on our community page, so you get to see more and have more. There is a hand up, but I would want to ask this question quickly so that Richard can ask his question. Can you explain what orphan drug is for? Those who okay, so can you explain what orphan drug is for those who may not be familiar with the term? That is from Jennifer Ruby Williams.
Okay. Thank you very much, Jennifer, for the question. So when we talk about orphan drug, so in rare diseases were previously also termed as orphan diseases. And just as you understand, the orphan, as it's socially understood, someone who has lost both parents, and so usually the support is limited and all of those. So orphan drugs are basically medications developed purposely for rare diseases. And so it has its own designation within the FDA path. They have their own path for approvals and all of those. So it's not like the normal path for other common conditions and how they get the research and development. The type of evidence that needs to be submitted to get authorization isn't the same compared to other common diseases. And so the US government has an act called the Orphan Drug Act. And I think through that act too, the government reimburses some of the costs in making those, or there are some incentives provided for companies that develop treatment for the rare disease community as well through the act. And so basically any drug that is made purposely for the rare disease, for specifically targeting a rare disease, is what we term as orphan drug. And so Ghana, we have a guideline for registering of the orphan drug. We are not, it's for those who want to register orphan drug, and they have a path for registering orphan drugs in Ghana. That's what is available at the moment with the FDA.
Thank you so much, Mr. Riafe. So then Joel was asking that I'm sure, Joel, you missed the earlier part where Mr. Riafe was explaining how come they are called rare diseases. I'm going to attempt it, but I tend to feel I shouldn't do that. But before I do, please, let's ask Richard to unmute because he has been on for long. Richard, kindly unmute and ask your question.
Yes, I think.
Hello, can you hear me?
Yes, you are audible. Kindly go on.
All right, great. Good evening. Interesting conversation. So my name is Dr. Daniel. I'm a pediatrician with special interest in genetics, and then also part of the rare disease community based in Ho Teaching Hospital. Prof will be very happy to host you when you are in Ghana. So I'll be talking to Mr. Riafe, and they will be very happy to host you. Just to also mention that the pediatric department of Ho Teaching Hospital has been heavily involved in some diagnostics with the help of Rare Disease Ghana. I shared one paper during the Pediatric Society of Ghana ADSM. A child who had a dual genetic disease. The one part of the disease was not amenable to any therapy, but the other part was amenable to therapy. And this child is currently doing quite well. So it is important we get some closure and some information for parents and then children who have this genetic diseases. I'm hoping that I would get to talk to Femo maybe out of this this call, and so that we can link up. There is what we can do. Of course, help can never be enough. I mean, like Oliver Twist, if you get more is always better. So that will be from us. So from Ho Teaching Hospital, we are very happy. We are happy with the collaboration we've had with Sam. Just to mention that the Goshe you mentioned was diagnosed in Ho Teaching Hospital as well. Thank you.
Yay! So that is Dr. Jano trying to get the acknowledgement that they deserve, which is good.
Yes.
Right. So let me just make a comment. I have to join another Zoom group soon. But I'm going to talk about, just make a comment about nomenclature. The names, where the names come from, and then the rare diseases, and also the fact that there are patients who may have more than one genetic condition. The nomenclature that originally was there is the doctors who first describe a condition in detail get the credit. So that's where you get all the names of Down. Landon Downs was a physician. So Down syndrome is named after him. Okay. You have Cornelia de Lange syndrome from Treacher Collins syndrome, all named after doctors. And some of us also may even have our own syndromes, named after us. That has kind of shifted because now that we have DNA diagnosis, many of the conditions that are being diagnosed are not being associated with names anymore, but they are being named differently. But keep in mind there are some genetic conditions that if you are one of the few people who were diagnosed, first, the condition may be so rare that sometimes it's a unique to one family, or maybe a few families, or less than 10 people, or less than 50 people. So there are rare conditions that you may not hear about. The doctors, even geneticists, may not know about. Currently, there are over 10,000 genetic disorders. So obviously, nobody can remember everything. There are ways, catalogs where we can always do research, to, find out. But, when we deal with communities that intermarry a lot, and you see that among some of the West African communities, especially the Muslims, and also in the Middle East communities, sometimes, rare disease genes may be passed from both sides of the family from generation to generation. So I have patients who have, some have two rare diseases, sickle cell and something, or even some very, very rare conditions. In fact, the highest number that I have had, there's a couple of kids who have 4 different diseases. Had one child with 4 different genetic disorders, all because the cousins get marrying cousins from generation to generation, and the accumulation of rare genes within those families. So those are very complicated uh, cases that are difficult to sort out. But from the genetic standpoint, because of the new testing, whole genome sequencing, we are able to tease out and tell, which genes are, functioning. In our community, in Ghana, the only community that I know of, but there may be others, is the Adomrebe community, where there's a lot of hearing loss, deafness, congenital deafness. I haven't heard that there are any other genetic disorders mixed with that. But when you go to that community, and I visited that, as medical students, we used to go there because of the high inbreeding that is in that community. There's a lot of hearing loss. There are a lot of people who cannot speak. They never learn to speak because they have congenital, deafness. There are probably now over 400 different genes that account for hearing loss alone. So genetic is very, very complicated. It's not easy, and it's not unusual that many of us carry patients. I followed some of my patients for 20 years before genetic testing became available and before we could name their conditions. So that's going to happen in Ghana. Most of what has been picked up in Ghana fortunately already have names attached, to them. But they may come. Don't be surprised if we find something in Ghana that has never been seen by anybody else. Those are my comments, and I thank you again for letting me make these comments. I will join you at some other time in the future. Any quick question for me before I leave?
Please, do you have any quick question for Prof. Anyane Yeboah before he goes? If not, we can still write it in the chat box, and then later we get to share with him through Mr. Riafe. Okay, so
Okay, good night.
Good night. Thank you so much for
No
joining
problem.
us.
No problem.
All right. So our time is up. I personally have enjoyed today's session. Thank you all for making it a point. Thank you so much, Mr. Riafe. Please, do you have any parting comments, words, things for us?
I would want to thank everyone for attending and for staying throughout the session. We have just started the Rare Disease Day campaign. We are running a 1-week long campaign through social media. So kindly follow our social media pages on Facebook, Instagram, Twitter, LinkedIn, anywhere, WhatsApp. Join us. Let us create awareness and raise a voice for the rare disease community. On Saturday, we will be lighting up the Black Star Square.
Ish. Wow. So please, is it open to all?
Yeah, it's a public event. And so join us as long as you have interest and passion for the rare disease community. Join us. Let us change the color of the Black Star Square for the rare disease community. And yeah. So anyway, you can support us too. We are open to receive support. We are non-profit, so we depend on donations and givings for our programs. So we are happy to receive donations as well if you have any to give. And we are also open. We are a very open organization. If you want to volunteer, you can sign on from our website, volunteer with us, join any of the teams we have, and happy to work with you. Thank you so much.
Mr. Rafi, could you mention the social media handles again, and then the websites, the full one? But yes, we'll be putting all those information on our WhatsApp community page for those who may not be able to have it now. So, Mr. Rafi, just mention for now, and then we later get to put it on our community page.
The website is www.rarediseaseghana.org. rarediseaseghana.org. And the social media at Rare Disease GH should, especially on many of the social media channels, should pop up Rare Disease Ghana. Otherwise, just type Rare Disease Ghana in your search and you'll find us. Our logo is very unique and you will not miss it. And so
it is.
And if you are lost, just Google Rare Disease Ghana and everything.
That's true.
And you have all the information. Yeah.
You can also search for Mr. Riafe on LinkedIn and you would have all the other handles that you need. Just type some more. Just if you know you'd forget the J, please type some more Riafe. You would see the J in there, and then you can connect with him, get to have all the necessary information that you would need. And yes, if you need help in getting to understand things, getting to know more, we at Mission Pediatrics are here for you. That is why the Parent Professional Connect is there to be able to help us all get to help each other. And yes, Nigel, unfortunately, our time is up. Let's go on our social media handles. You can ask at Mission Pediatrics or join our WhatsApp community page, and then we'll get to have more. However, this particular webinar is being live streamed on our Parent Professional Connect on YouTube. So please, on YouTube, you would have access to all these questions that you have. You can share with others, you can like the page, you can let someone also get to learn something. So please, let's make it a date. And before I forget, this program is one that we want to have more of our health professionals get to learn, get to have their CPD points. So for our registered special needs educators, clinical psychologists, those who are registered with the Ghana Psychology Council or the Ghana Medical and Dental Association, we are working towards getting you the CPD points attached to our webinars. So please, we would share the link later. Do sign in, write your name and then the webinar for which you attended. And then we would let you know more on how you can get your points. Thank you everyone for being a part of tonight's webinar, tonight's event. Thank you for taking time to be with us. Thank you for always showing up. And we would be seeing you on the 4th Sunday of next month, please. The 4th Sunday of next month. Every 4th Sunday, we get to have something interesting being shared with us. Do make a date with us next month as we talk about neurodiversity, focusing our attention on Down syndrome. Thank you all. Have a good night and enjoy your week. Bye, everyone.
Okay, bye. Bye, everyone.